I'm teaching HK4610. So it's a fourth year course that is called Health and Injury Biomechanics. And so essentially the goal of the course is to take students on this journey of essentially what life is like to be past their undergrad and working as a clinician. And so we essentially take it from bench to bedside, where we essentially look at kind of the nitty gritty of tissues, whether it be cartilage, tendon, ligament, bone, nerve, how they act biomechanically, what forces we subject them through normal life, through athletics, and then progress it all the way through for how they operate and what forces essentially dictate failure. And then we essentially through to what that looks like clinically. Why did they fail? What was the mechanism of injury? How does it manifest in terms of swelling and strength loss and weakness and all of those fun things? And essentially try to paint a clinical picture, but all tying it back to the biomechanics as to what biomechanical forces were normal, what were abnormal, what biomechanical risk factors perhaps predispose this athlete or patient in front of you into injury. And then we essentially, the whole goal of that is then to design some sort of program to which then we can address these biomechanical faults and ideally get somebody back to functioning. And so I'm frankly pretty jealous of the fact that students have the opportunity to take this course, not because I'm biased because I'm teaching it, but essentially my whole mindset in designing the course was what course would have helped me better prepare myself for professional school, and more importantly, prepare me to then be able to better serve patients and clients in the community in a clinical practice. And so essentially I've designed the course around what types of things would have gotten me enthusiastic, would have gotten me interested in the material, what type of learning style would have been able to prepare me for the differences in learning style that you can expect in professional school. And so we employ a bit of a problem-based learning environment where certainly there's didactic components where there's lecture and kind of absorbing material, but then there's very much a clinical aspect where we're trying to employ the material in a practical, meaningful way. And so we design simulated patient, simulated scenarios, simulated assessments to which we use all of this background information to then be able to apply in a real world, assuming that this paper case is somebody real in front of you, desperate for your help to make them better. And so we take them across a journey where we look at histological slides of what, let's say, a healthy tendon or a healthy ligament versus a chronic degenerative tendon looks like and what that looks like in person. And so it's pretty fun to kind of be able to learn something that you then know later in the course. There's going to be some sort of challenge presented to you to be able to then fix somebody. And so it's pretty motivating that, at least I find it very motivating to learn when there's somebody on the other end of it who's needing my help. Yeah, so essentially the first half of the course is all designed around giving them the foundational knowledge. So each lecture is going to be tied to a specific tissue that we look at what's normal and abnormal and what it looks like when it's injured. And then the second half is very much, we have a lecture based off of clinical assessment. So they run through what a clinical assessment looks at, what types of questions are needed to ask, what's the meaning behind those questions, how to rule out red flags, what does special tests mean, the psychometric properties of that psychometric test or that special test. So then we know it has clinical value. Then we essentially look at each joint, or at least major joint within the body. We look at the upper extremity, lumbar spine, cervical spine, etc. And with the most of it being asynchronous learning, so the students have the opportunity to be able to learn at their own pace. They have the opportunity to kind of watch and rewind fast and slow, depending on what they need. But there is going to be a ton of opportunities for synchronous learning where there's live interaction happening between myself and the students, the TAs and the students, both in terms of office hours being available to them, as well as essentially I'm going to be sending out a lot of surveys throughout the semester to help let them dictate which direction we take this course in. And so I'm more than happy to facilitate mock assessments where I essentially bring a simulated patient, and perhaps for every week, if we're on neck week, I would run through what a neck assessment would look like, what the special tests look like, how to do them, so then they could perhaps then practice on their roommate or on their mom if they're back at home. and be able to kind of work through everything systematically. There's opportunity if kind of public health, the university, HBC allow for it, and students are in town to be able to kind of come into clinic if the situation changes, to be able to then see real patients as opposed to just simulated patients. And so there's a ton of opportunity, both synchronous, asynchronous, being able to learn on their own, diversity in both kind of written materials, spoken word, et cetera, to be able to kind of go through it. And then hopefully they get their hands wet a little bit to be able to kind of practice some of these skills that we review on kind of a loved one or whoever they're staying with. Yeah, so for the kind of first half where it's all the foundational stuff, we've designed a quiz a week, so a lot of low stakes assessments for them. So they can expect to essentially digest the material over the course of the week, and then at the end of the week to be able to be challenged on just that week's material, so they can really kind of sink their teeth into just that stuff as opposed to trying to kind of manage the cumulative aspect. And then in the second half, when things get a little bit more practical and clinical, then we're going to have two prompt-based assignments where they're going to have the simulated case in front of them. They're going to pair up or kind of group up in groups of 3 and then run through that case and then present that back into a document and submit that off to us. And so there's essentially going to be 8 kind of evaluations throughout the course, so they don't have to necessarily stress on anything being overly weighted for them, with essentially all of it being practical, and then a final exam that essentially wraps it up with the assumption that it's going to be cumulative and still on that problem-based train. Yeah, so there's going to be a written case, so there's no way to make that synchronous. But then essentially, I hope to reenact that case in a synchronous way. And so there's going to be a live tune-in on a Zoom call where I'm going to be running through that assessment, and my simulated patient is going to be essentially scripted to answer in accordance to the case that was written for them. And then there'd be a question and answer period at the end to explain perhaps parts of what I was doing. But the most of it is going to be you kind of digest what was shown in front of you. We record it, submit it, and then replay it, and then kind of look up what all these special tests mean, what they rule in, what they rule out. No, I've essentially, there won't be a textbook to the course. Everything that they will be evaluated on will be touched on, whether it be in video format or written format. That's all uploaded to CourseLink for them. And so, no, it's important for them to start thinking, and I'll be presenting kind of announcements leading up to the semester for them to perhaps kind of relook at their prerequisite course, the clinical biomechanics course. But otherwise, no, they'll have enough fun with us that they don't need to go searching for more information. Well, I do want to say that I understand that this is all difficult for the students. They by no means plan for their 4th year to look like this. Unfortunately, we're given a situation that we have to adapt to. And I think that all the instructors are working really hard to give you a pretty enriched learning experience. It might look different, but you're going to see a lot of value in what you take, and it's all going to be practical for you to then be able to apply to real life outside of the University of Guelph. And so know that the instructors are working really hard to adapt, provide us with a ton of feedback for what you need, and we'll adapt to your learning needs. But otherwise, work hard as you always do, and we'll get through this together.